मेरा नाम सत्येंद्र सिंह रावत है। मेरी एज 52 है। मेरे कुल्लों में प्रॉब्लम थी, दोनों कुल्ले चेंज हो रखे हैं। मैं ऐसा हुआ कि मैं बनवारी लाल चैरिटेबल हॉस्पिटल पे गया था, तो वहाँ मैंने एक्सरे कराया था। तो उसने मुझे कंप्यूटर पे दिखाया था कि अंकल आपके कुल्ले बिल्कुल ख़राब हो गए। फिर मैं परमानंद हॉस्पिटल में गया तो डॉक्टर साहब बैठते थे वहाँ 2 दिन हफ्ते में, तो मैं डॉक्टर साहब मुझे मिल गए वहाँ पे। फिर मैं डॉक्टर साहब से बात करी, वो बोले आपके कुल्ले चेंज होंगे जी। मैंने कहा ठीक है, कोई बात नहीं। फिर मैं 21 जुलाई को 2011 हॉस्पिटल में एडमिट हो गया। 22 जुलाई का मेरा ऑपरेशन हो गया। तो मुझे जैसे ऑपरेशन हुआ तो मुझे पता नहीं था कि इस पैर में मेरे कभी तकलीफ थी। फिर 1 हफ्ता मैं हॉस्पिटल में रहा। 1 हफ्ते बाद में 4 हफ्ते का रेस्ट डॉक्टर साहब ने लिखा था। डॉक्टर साहब मुझे कह रहे हैं यार, आप लोग तो कहते हैं आप छुट्टी ज़्यादा लिखो, आप तो कहते हो कम लिखो। 4 हफ्ते बाद फिटनेस लेके आया। फिर मैं ऑफिस जाने लग गया अपने। फिर 2 अक्टूबर को फिर मैं हॉस्पिटल में जाके एडमिट हो गया। फिर 3 अक्टूबर को फिर मेरा दूसरे पैर का ऑपरेशन हो गया। उस दिन से मैं बिल्कुल ठीक ठाक हूँ, मुझे चलने फिरने में कोई दिक्कत नहीं है। हाँ, बीरेन नादकर्णी वो तो हमारे लिए भगवान की तरह है।
Mr. Satinder Singh, he was a 49-year gentleman then, and he had come to us with a lot of hip pain on both the sides, and he was not able to move around, he was not able to do his normal activities. All his activities of daily living were very restricted, and when I saw him, examined him, and I could feel that there is something wrong in both the hips, and we got his x-rays done, and we did the usual workup we do for all these patients. And on seeing the x-rays, it was very clear to us that he was having osteoarthritis of both the hips, which was secondary to avascular necrosis of femoral head, which is a condition which happens because of loss of blood supply of the femoral head, and it leads to excruciating pain initially, leads to collapse of the femoral head, and ultimately leads to secondary arthritis. And because his age was 49, he had most of his life in front of him, and we suggested the best for him, and we suggested a large diameter metal and poly total hip replacement, which is the state of the art technology at the moment, and that's what we did on him. We suggested both hip replacements on one sitting, but because of some issues we started with the right hip first, and the right hip was done first. And he was admitted a day before we did the surgery, and we discharged him about 3 to 4 days after the surgery. And since the left hip was still painful, he could not do very well immediately after the first surgery, and his ultimate results came after we did the second surgery, which was about 2.5 to 3 months after the first surgery. When he came to me, I recall that he was in a lot of pain. He was brought in a wheelchair by his relatives and was barely able to walk, and using a stick for ambulation sometimes if he had to go around. And basic activities like going outside, going to the office, he's a working employee, he was not able to do any of these things. And at the moment, he is doing all the activity which a normal person can do. He is living a normal life, he is going outside, he is even driving a scooter, and he can climb upstairs, come downstairs, and he can even sometimes squat and do cross-legged sitting, although I do not recommend that for him. He is living practically a normal life.